Welcome to this special Gastro Girl podcast. This episode was produced in collaboration with the American College of Gastroenterology's Patient Care Committee. Here's your host, Jacqueline Gaulin.
Hey everyone, welcome to this episode of the Gastro Girl podcast. This episode is produced in collaboration with the American College of Gastroenterology's Patient Care Committee, and today we're joined by the esteemed Dr. Bilal Hameed, who is a gastroenterologist and hepatologist at the University of California, San Francisco, and he cares for patients with liver disease, and his expertise includes providing care before and after liver transplantation. Welcome, Dr. Hameed. So happy to have you join us today.
Thank you so much. It is my, honor to be part of this podcast. I'm looking forward. I listened to it myself, and I think the work you have been doing and to provide education about the liver disease and other, it's just amazing. And I'm just happy to be here.
Oh, thank you so much. And today, we've done some previous episodes on fatty liver. We did a general one about the liver. Now we're going to talk specifically about alcoholic liver disease. And this is something I know that has been increasing, especially post the COVID pandemic, when we've been seeing more and more instances. I'm sure you've been seeing this in your clinic of patients that are presenting with alcoholic liver disease, and especially at a younger age, possibly. So we're going to dive right in because it's such an important topic. So first of all, can you explain what alcoholic liver disease is and how it develops over time?
Yeah, that's an excellent. First of all, I think before we talk about alcohol, I think there's a lot of stigmatizing terms that it's more alcohol associated or alcohol related liver disease, because this is a disease that has been associated in someone who is drinking alcohol, and it has changed. So destigmatizing was a very important thing, especially we used towards alcoholism. Now we use alcohol use disorder, and that helped because what happened that patients, when we were using these terms, patient was were not seeking help because we are kind of stigmatizing them. And that actually helped and spread not only the knowledge and patient education, and also help with the newer, uh, research that we are using it. So that's where you will see on the lot of these on your clinic notes, when you see by the providers and also by the new guidelines, these words are like alcohol associated liver disease and also alcohol like use disorder, and that is a very important thing. Now alcohol is also leading cause of morbidity and mortality, and it's more acute as well as chronic alcohol contributing to many emergency visits and a lot of death. And the one thing is that there is no perfectly safe level of alcohol. One thing also, we also try to tell patients that alcohol doesn't only impact the liver but impact the whole body, and also it impacts the brain, the gut, the pancreas, the lung, cardiovascular, and immune system. Now also for our patients to understand that when alcohol, 90% of absorbed alcohol is metabolized in the liver, and the organ is extensively exposed not only to alcohol but also the alcohol toxic metabolite, and that can lead to both acute and also some form of a chronic injury. And there are certain risk factors that you mentioned. And then recently, since COVID, and we also, in the past, we were seeing more like middle-aged, older men that were coming in. But now this disease is like seen in more younger and being female. It's also some of that patient with obesity. There's some genetic factors. And one thing is that what we have seen for unclear, like patient who had gastric bypass surgery, that they are more prone to alcohol. Now, alcohol can cause different patterns of liver disease. The first is development of what we call fat in the liver, or the medical term is steatosis. Steatosis means accumulation of fat, which is the earliest liver injury that we see. And patients who drink heavily, about 90% to 95% will have it. And that can be reversible if you stop drinking. But then if you keep drinking, it can cause inflammation. And that's where we call steatohepatitis, or hepatitis related to alcohol. And that is can cause your liver test to be elevated. And it can also lead to scarring of the liver. And the concept of scarring or fibrosis, but people always, that liver injury, or if you have liver inflammation, liver try to regenerate. But sometime in the process of regeneration, rather than forming a normal liver tissue, it forms a scar tissue, which we call fibrosis. And it goes to different stages or different level, one, two, three, and four. And four is what we call cirrhosis of the liver. So when you have inflammation, about 20 to 40% of patients with alcohol develop this inflammation. And ultimately, about some of these patients can develop cirrhosis of the liver.
So this has been such an illuminating discussion already, and we haven't even really started. But the fact that you clarified what I was calling alcoholic liver disease and that it's alcohol associated liver disease, I think is so important because it is stigmatized, right? You think, oh, well, you're an alcoholic, and and we don't, oh, I don't want to go to the doctor because they're going to think I'm an alcoholic. And you may have this alcohol associated liver disease and you want to get to the doctor. So, thank you for correcting me or educating me and advancing our thinking about what liver disease is, because I think that is a huge step forward in getting patients to the provider so they can get an accurate diagnosis and to get into treatment. So, thank you for that. And I like how you have brought the you've showed us how the progression to cirrhosis. Can you explain what cirrhosis is for those of us that may not know what that is?
Yeah, so cirrhosis is the term which is basically like, have been different ways and people, and that's the one thing when someone tells that someone has cirrhosis of the liver, it's one of the most scariest thing. And first thing everyone does is go to Google and write cirrhosis, and they're still like seeing that, oh, you know what, someone will gonna die, all these complications. So cirrhosis is the end stage of any liver injury, right? And as I mentioned, it's just basically when the liver architecture of the liver start having a lot of scarring and distortion of the architecture of the liver. Now, ultimately, the cirrhosis diagnosis can be like make histology with like biopsy, but there are some indirect findings on blood tests or imaging or non-invasive testing. We can say that someone has more advanced scarring or fibrosis, or what we call. And as I mentioned, this scarring stages goes from zero, meaning no scarring, then one, two, three, and four. And four is what we call cirrhosis of the liver. Now, it's also important to know that not every patient with cirrhosis will have symptoms. Many patients will have this cirrhosis and have no symptoms, and as compared with any chronic condition, right? That like diabetes, you have patients with diabetes who just control with diet, as compared to it, there's another extreme that they have diabetes and have bad infection requiring surgeries and amputation. So cirrhosis has also been divided in what we call compensated, like patient have no complications or liver disease, and then there's a word that we use like decompensation or symptom of related to liver disease. So cirrhosis is in short, is an end stage of liver, which is basically a lot of scarring, distortion of architecture, and it can be caused by many different conditions. And alcohol is these days our number one cause, and it's a very common cause, but it can be caused by other things also.
Now, that's a really important point. Let's back up a little bit and talk about the early warning signs or symptoms of alcohol associated liver disease that people should be aware of. Like, what would we notice about, is it jaundice? Is it stomach pain? Like, what,
Great.
what would we should be aware of?
Yeah, so I think that early sign when we talk about it, that majority of patients will all be asymptomatic. They would
Oh,
not know.
wow.
And
Oh, wow.
that is like, it's only when your liver has a lot of damage already with a lot of inflammation. But the earliest thing that, sometime when you go to your doctor and they do the blood test and you see that the liver test or liver enzymes have been elevated, and that's the one thing that you can see that, there is maybe some inflammation that has been going on in the liver. But then the other things that sometimes patient, can just have fatigue or tiredness, and they're like trying to understand what's going on. They may not have good appetite, right? Nausea or vomiting that can happen, especially if there's a lot of inflammation that's going on. Patient can have like just pain around the liver area or abdominal discomfort or pain. They can have like weight loss. And commonly that we associated, if there's a lot of injury to the liver, you can have jaundice or what we call yellow discoloration of the eyes. And those are the things that we worry about. And in more severe cases, you can have water buildup in your belly or abdomen, which we call, the word is like ascites, but your belly get distended. And same thing that, if liver have a lot of damage and your liver is not, it's like, I always say the liver is an organ with multiple different functions, like a Walmart with different sections, right? So liver only not do one thing, it does many different. And one of the things liver does is clear toxins. And in severe form, if liver is not able to clear the toxins like ammonia, it can build up in your brain, and some patients just present with confusion. So it goes with no symptoms or patient just elevation of liver test and may have early like fatigue or tiredness, or they may have or like weight loss, then nausea, vomiting, some abdominal pain, in extreme form jaundice, buildup of water in the belly, confusion, and may have even bleeding, like you can have like blood in your stool or through
Oh, wow.
also in severe cases.
Wow. It's kind of scary to hear all this. How many people are affected by alcohol associated liver disease? How common is this?
As a cause of, as I mentioned, that as a cause of liver transplantation, this has been like significantly increased. And then in like, there's some data that in 2019, about close to 50,000 death in 2019 was attributed, were liver disease related, and half of them was related to alcohol associated liver disease. And the death rate from alcohol related cirrhosis has increased significantly. And in the past, like, 2000, 2019. And so that has been like, so we are definitely seeing more increase of liver transplantation and alcohol related liver disease, and COVID did not help in that scenario. And that's, the demographic is also changing. It is more young. Also we're seeing more into the female, and I think that is also very eye opening for everyone. And there's also a recent study from Canada also suggesting the thing. So it's not only the trend in the US, it's other part of the world, they're also seeing the same thing.
So, I've read some studies recently that look at binge drinking, especially among younger women. They have everything else is healthy. They exercise, they eat right, but then they go out, two or three times a week and maybe they're not eating, but they're binge drinking. What is your advice for those people who may think that they do everything healthy, but then, they binge drink? And what is binge drinking? What does that
Yeah,
mean? Like, how
yeah.
many drinks for women or men? Like, what is a good number?
Yeah, there is.
Everybo
I think that is one of those things that, what the, when we look at the harmful, like, drinking is like, for male is like greater than 3 drinks per day or greater than 21 drinks per week. And for women, it's greater than 2 drinks or greater than 14 drinks. But at the same time, when we ask these questions, it's like there are three things we are looking at it. How often do you drink alcohol? How many drinks? And how often you have 6 or more drinks on one occasion, right? And that is some of these things that point towards us that, and then that is we have seen like in youth, especially college student and young people, that we have seen binge drinking and they feel like that is not harmful. But these are all the factors that can lead to more chronic liver disease or more, alcohol related liver disease. So these are the things that we are focusing more and more in this regard. So, I think that is the one thing that we are paying. Now, also, there is a question about like even a lot of our providers and like, what does one drink mean, right? And I think that is so it is like, 12 ounce of like regular beer, right? That is one drink, or 8 ounce of malt liquor, or 5 ounce of like table wine, or, if you have like 1.5 ounce of like, of shot of like distilled spirit. And these are like, now, there are a lot of good. I think the one thing that we have, like both, there are certain societies, especially like NIAAA, which is like National Institute of Alcohol Abuse and Alcoholism, has very good, like on the website, has very good even patient education material. And a lot of providers are using those things and have talked about what are these drinks and how we look at it. But it is very important that, these risk factors, especially the binge drinking also. Now, there is also one thing I just wanted to mention, that there are some genetic variants also. And then there's a lot of talk about it. And there's certain genes that we have identified that is being seen in that. And so I think that is always research that has been ongoing. We see family members, and this is like also a lot of genetic predisposition with this thing. And those patients need to be like, we need to be more proactive in working with those patients early on.
What can we do in our lifestyle? Like, what lifestyle changes can individuals make to prevent or slow down the progression of alcohol-associated liver disease?
The most important management or treatment is abstinent or stopping alcohol. I think there
Uh-huh.
is no question about it. But at the same time, now we have been educated, and we as a medical community did not do a good job in understanding and discussing with our patient. And now, if you look at the new guidance and new guidelines and discussion, is that we wanted to have more discussion with our patient. And there are some like questionnaires we can ask the patient if we think that someone has been harmful drinking, and then started having early discussion and incorporating like motivational interventions into our clinical care, right? Now, when we talk specifically about the risk factors that in some patients with heavy alcohol use, also recommending abstaining use of tobacco in any form because it has been associated worsening of the liver disease. In person who are overweight or obese, also avoiding alcohol consumption, and same with patients who have metabolic syndrome, meaning they have obesity or weight gain or diabetes. We also help with those symptoms because we know that we have. Now, patients who have chronic liver disease like chronic hepatitis C or chronic hepatitis B, the recommendation is also avoiding alcohol in that sense. Now, it's seeking help early and we asking patients early on. Now, it's also now in many big centers, especially transplant centers, the new thing that we are doing is have multidisciplinary clinics. And the concept of it that we wanted to provide the best and care with multiple specialists. Like giving an example at UCSF, we had this clinic for alcohol related liver disease where not only the liver specialists, we have transplant psychiatrists, we have addiction specialists working together and understanding what patient need, because every patient will need different intervention. And also now we also working on using what we call alcohol relapse prevention medications early on in patients who have a problem with this disease, and then managing with that regard.
No, those are really great points, and, you know, it can be embarrassing for a patient. Maybe they're listening to this and they know that maybe they do the binge drinking, but they try to live a healthy lifestyle. Like, what are your tips for them and how to approach their healthcare provider, for help or to, if they're concerned that they're damaging their liver? Like, do you have any tips for those patients?
I think everyone is individualized. The one thing I always have to back up that, a little bit, that we are also seeing more alcohol associated liver disease in lower socioeconomic status and also with minorities, Hispanic and Native Americans. And I think that is one thing that, addressing some of the social disparity, language barrier is a big part in healthcare. And I think that is one thing. So we always use interpreters because we cannot like have those. And then always like in my point of view that while we have patients who comes in with family members, I try to interview them alone because a lot of things they don't want to discuss in front of their family members. Same with like, if you're dealing with, young adult, like, also I don't see like adolescents or young, but, in very common in children doctors that they also talk to the kids in a like, separate than the parents to learn more about what they are going through it. And I think that, since the COVID, there are a lot of other mental health, conditions that we are seeing. And so seeking help because doctors are providers, they are advanced practitioners, are there to help you. And then, or they guide you. We have now more resources to have, like, if we think that patient need more help, we have addiction specialists if they have it. But this is your health we're talking about. This is your life, right? And reaching out and talking about, and if you feel like, just asking, like, I do worry about it or I drink this much, what is the harmful drinking? How much I can drink? If there's any health condition that I have, whether I can be worried about, because as I mentioned, like, patient with diabetes or patient who have been overweight or metabolic syndrome, someone with chronic liver disease like hepatitis C or hepatitis B or other conditions, we advise them not to have alcohol, right, as compared to other conditions that we say, what is the safe limit? And we also had patients that who, this isn't a disease, right? They can stop and they can have relapse. But I tell them that, we are working. There is no judgment. We wanted to help you because no one is judging you. It's a disease, like same with patient with diabetes. They come in and they stop taking the medications, right? And their diabetes get worse. Doesn't mean that we are judging. We work with them. And then one size is not going to fit for everyone, right? There are different medications, same with different strategies. Some patient with this just need some motivational, like, discussion, and some do need medication, right? And then that's why I think important, the trend that we are seeing more and more, and we are being more proactive as a liver and other even primary care, is to start using these relapse prevention medication early on, right? And I think that is the one thing that we are focusing and working on it more and more.
Oh, I'm so relieved from the patient perspective that you said we're not judging you, because that is such a barrier in our own mind when we're going to a provider and we feel like, oh, haven't been eating right. We haven't been doing enough exercise. We've been drinking too much. I'm so embarrassed. I don't want to tell my doctor this, but I'm defeating myself and I'm not doing myself justice if I'm not honest with you,
Right.
because that you're not going to judge me. You went into this field, I would imagine, to help people, not to judge them. You could stay home and go on TikTok and judge
Yeah.
people, but you chose to
Correct.
go to medical school and spend lots of time learning to help people, right?
Absolutely. I think that is a very important, like, that the trust and the comfort level with your provider is the key. And I think that, I grew up in, like, back home where the physician is your family member. Like, it's like seeing every family member of your, and they are like working and hand holding, and you can go and ask. I think that's kind of a relationship we strive for our patient. And we wanted to help them. And as I mentioned, that every patient can be different and every patient can have different needs. And as providers, we need to identify how we can help that patient in that regard.
So I have a few more questions. This has been such an interesting conversation. So before I get into the treatment options, are there any misconceptions about alcohol associated liver disease that you commonly see in your practice?
Yeah, I think the first thing is that what I see, that when we talk about them, as I mentioned, there are many other causes of liver condition, and sometimes when we tell someone that you have liver disease, a family member just automatically assume that they are drinking alcohol, and they are not. Right now, the second thing is that they are alcohol. This alcohol-related liver disease can also happen with other liver conditions, right? And that's why someone with other chronic liver condition, like what we call metabolic syndrome with alcohol, and then and those patients we worry about more, and we wanted to make sure that we discuss them early on, right? Now, at the same time that, we have seen this, some of these things that patients doesn't have, like, belief that alcohol is causing that damage, right? And it's a very different thing that my friend or my uncle or my father was drinking the same amount of alcohol, they didn't have liver. And that's why there are many other risk factors that you may have, or your friend may not have it, right? And so we tell, like, whatever alcohol you are using is damaging your body and your liver, and you need to stop that. And I think it's that. And then there are something that, there are patients who may not able to stop alcohol right away, and they think that when we go to the doctor they would judge me and they would gonna talk. And sometimes it's a stepwise approach, right? And as I mentioned, that we go through different things, that, what is best for that patient, right? And at the same time, like, some people think that once they develop liver disease, it's the end of the world, and then they would not gonna make it, right? Because many times when you stop drinking alcohol, the lot of liver damage can get better also, and it's only with the blood test and with expertise we can say. And even with patient with more advanced liver disease and cirrhosis or more damage, with stopping alcohol, things can get better, and not everyone will gonna progress, right? So this is very, very important to understand that, seeking. And I think importantly, like having, and listen to your families, because the families are the one who knows more about what it, and be honest to your providers. Again, it's there is no judgment, because if we don't understand what's going on, it would be hard for us to actually like help them, because if there is the clear understanding and what's going on, it's easier for us to help the patient.
Thank you. So liver alcohol-associated liver disease is usually diagnosed through the blood test, and then they do any scanning or anything, like, to definitively, like, if a patient comes to you and you're the signs that they say and the symptoms that they can relay to you, what's the next step in that? Do you send them for a
Right.
CT
So
scan or something?
yeah, so I think it's a good. I think the most important thing is about like history. Is that the history will tell us like how things have been, and then we start with like obviously we start with the blood test to see what the liver enzymes are doing, and also majority of the time the liver tests are elevated, and mostly we are seeing in young patients, and we also check for other causes of liver disease, because we cannot like exclude, like we wanted to make sure there's nothing else beside alcohol is contributing to those inflammation, which is elevation of liver tests. And most of the time that it's a clinical diagnosis, but at the same time we do have like imaging, and ultrasound itself is a very simple test that we actually do it, and ultrasound can help us identify if there is steatosis, which again, simple word is like fat in the liver, and also start with if there is some other. In the past, some patients were getting liver biopsies to identify how much. We are
Oh,
now rarely doing a very few liver biopsies in this condition. Only thing is that if you still worry about some other condition beside alcohol contributing to it, we have what we call non-invasive testing that we have available now. These are blood tests as well as some kind of an imaging test that we can use to tell how much damage has liver has been done, how much fat or steatosis is there, or how much scarring is done. So these non-invasive testing, we can use it. And these are some of the things that we have. Now, also, as I mentioned, I always again can I say the alcohol not only affect the liver, it can affect many different organs. And they are therefore, when we do the blood test, we try to make sure that we looked at other things and then talk about as a whole with the patient. So most of the time it's history, the blood test, and some comorbid. We don't have to do like a CT scan or MRI unless we worry about something else, right? And I think the one thing that patient, when we do these things, and some first concern like, do I have a cancer? And then I think that is a very common. So patients who have more advanced like cirrhosis of the liver, they may be at some risk of developing liver cancer. And those patients who have cirrhosis of the liver, there is very clear guidance that they do scans or we do imaging every 6 months to look out for if they have developed any cancer or not.
okay. Wow. So once you've determined that a patient has um, alcohol-associated liver disease, what are the treatment options? Like, how do I treat this? Like, what happens next?
Yeah. So again, depending on where they are with the liver disease, right? As I mentioned, there are many patients who just have steatosis or just develop fat in the liver, and once they stop drinking alcohol, that's a reversible thing. That when that happens. Now the second is that they have just inflammation of the which we call steatohepatitis, and again, the first and the most important thing is stopping alcohol. Once you stop it, you'll see the improvement in the liver tests and liver enzyme, and those patients may have some scarring of the liver or not. Now, there is one extreme form, or which is what we call alcohol associated hepatitis. That's the one thing that it's a clinical syndrome that develops suddenly in about 20% of patients who drink heavily. And it is like patients suddenly develop yellow eyes or jaundice, and they have more liver dysfunction that we say that they can have other things. And those are the patients that has like we worry about, they need hospitalization, and depending on how severe that form is and those conditions, we may use steroids or what we call corticosteroid in selected group of patients to identify. But the important thing is that stopping alcohol is the single and the most important thing. If patients just have early disease, I think that, and if they have, as I mentioned, we have used alcohol relapse prevention medications to make sure that they don't.
Okay.
But and then in some severe form, which we call alcohol associated hepatitis, they may need corticosteroid, but that is a selected group of patients that we do about. Now, they are obviously, if someone has very sick with alcohol, now the whole new world or new thing is in selected patients, they may need a liver transplantation, right? And so that is an important aspect to it, that things how we think about liver transplantation in the past until now has completely changed, right? Because in the past, majority of the places require patient to be off alcohol or sober for more than 6 months, but now things have changed. And like, many places does not have a minimum or any sobriety. It's all about whether when when was the when it was the first time that they have been like told about the liver disease. They may not have prior knowledge of the liver disease. They never been told. They never had too many relapse, and every place has some different protocols. So I think that is an also a very important thing that have changed. Hopefully, with future, we can standardize that. Rather than having every center have their own criteria, and it's a lot of research that has been going on, a lot of progress that has been going on. At the same time, there are a lot of investment by the NIH and pharmaceutical company about newer treatment if patient is really sick in the hospital with alcohol associated hepatitis, and there are a lot of ongoing clinical trial that has been going on. But still, last 50 years, corticosteroids or steroids are still if someone is really sick in the hospital.
Thank you. So, how can family and friends support someone who is struggling with alcohol associated liver disease?
I think it's a very important aspect, and even like when we see patients who have either for liver transplantation or just with alcohol, I think having patients who have more social environment and more social support that has benefited the most with the HAP. And majority of the time that what we have seen, and I know not like that we have either spouses or family members also drinking at the same time together, right? And it is like just like when we talk about obesity and weight loss, right? If we do it together, that helps. So, and I think that most of the time that it is because if you have, and that's the one thing our social worker, addiction specialists, to talk about whether you have alcohol at home, right? And I think that having it together, working on it together would be the most important thing. And I think also, encouraging patient to seek help, right? You can, and most of the time is when you talk to them, it's like family members who are telling, like if you look at some of the criteria, that it's like a family member or friend, like patient may not be aware of it, and like you have these things. So I think that also understanding that this is a disease, it can be reversible if you find it out early. They are, and so we encourage family members to talk to the patient, ask patients to seek medical help, and if you are drinking, also work together and have a plan, right? That we would cut down on alcohol and stop it together, and having just taking the alcohol out of the house also help in many scenarios.
And I have two more questions left. The first is, what advice would you give to someone who may be at risk of developing alcohol associated liver disease but is unsure about seeking help?
I think that it's just like the fact that you worry about that you are at risk. It's just that you're also very like understanding of that. That can be in majority of time. We have seen that patients have family members with that disease, right? And as I mentioned, that there is a genetic component to it. And I think again, seeking out help, just asking like the questions. And I always tell the patient that sometimes when you come to the doctors, we may not have. Now, the one thing in our centers, like patients sometimes send us all these questions beforehand on our, so that we have it written down, right? These are the things we need to address to our patient, and then clearly mention like this is the amount of alcohol, this is my family histories, and then physicians or providers are aware about your risk factors, right? And as I mentioned, I can keep bringing about these metabolic syndrome and other things that you have it, and then just specifically ask. And sometimes we can just do simple just by the history or just blood tests, we see where things are. And now we do have non-invasive, as I mentioned, in someone with liver test elevation, we have non-invasive testing to see if someone has already have some scarring, and most of these patients are asymptomatic, and that's where with non-invasive testing we can say that you have some liver damage, and I would encourage you to stop. And then there are other form of patients who think that they have tried and they quit and they're not successful, right? And those are the patients we talk about motivational, speaking, as well as seeing a psychologist, addiction. And in those patients, we have, and to be honest, many of our patients are asking that I have gone through all these things. I'm willing to try medication. And then we are also asking and we are prescribing and they are helping it very impressively. And although we need more data, but I think that is being there are FDA approved medication that we can use for alcohol relapse prevention.
Great. And, just to in our final question, are there any resources kind of going along with you're not alone patients if you're struggling with this? Are there any resources or support groups that you're aware of that are available for individuals and families that are affected by alcohol associated liver disease?
Yeah, I think so. They are, as I mentioned, that the American Liver Foundation has like a very good resource available. National Institute of Alcohol Abuse and Alcoholism has good resources are available. I think these are the couple of these things that we have it, and majority of time, I say that a lot of your local hospitals and places have been like have also have resources like especially with like places like us where we have social workers and social and addiction specialists, and we are reaching out to it. But they are, and this is like we are understanding the how much a problem it is, right? And this is again a disease which is having a high mortality, morbidity from various and affecting many different organs. And we, as a, this multidisciplinary approach and making it like a priority. And I'm happy that the research funding is coming on this thing. And I think patient voices are so important and family voices. And I think we need to hear more about from the patient side of things, like what has been helping them and what they need, right? Rather than we telling them, we have to also start listening to those and hear about and how we can provide better care to these patients with this disease.
Well, patients, if you're listening to this, please don't feel like you're alone. There are resources, there's options, there's treatment and support for you. Don't be embarrassed. Don't feel like the providers are judging you. They're there to help. Dr. Hameed, thank you so much for your time today. And thank you to the American College of Gastroenterology's Patient Care Committee for suggesting this episode and working with us to make it happen. Again, thank you. Don't forget to like, subscribe, and share this episode with your friends and leave us a review so the word gets out even more. Thank you so much.
Thank you for the invitation.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.